in 2021, we know that the vaccine is out for the coronavirus, COVID-19, and to talk about the safety of it and the importance of the vaccine, we have Dr. Jody Lenko back on our program, and she's with Lehigh Valley Hospital in Hazleton, the vice chair for the Department of Medicine here at the Hazleton location. And doctor, thanks for joining us back on SSPTV News.
Thanks for having me, and Happy New Year.
Happy New Year to you too. A lot of questions with the vaccine, maybe some uncertainty to some. I know people have strong beliefs on whether they want to receive the vaccine and whether they do not. From a professional standpoint, can you talk about the vaccine, the safety of it, why people should get it?
Sure. So it's quite exciting over the last few weeks, even though we're in the midst of this, horrible pandemic and another surge. We do have a little bit of brightness at the end of this, hopefully, tunnel soon. We've been vaccinating now for almost 3 weeks. Our first set of physicians, providers, nurses, and staff will be getting their second vaccine later this week in Hazleton, as well as throughout our health campuses. So it's been quite exciting to be able to start this process of prevention in more ways than just social distancing.
When we talk about the safety concerns, this is a vaccine that has been developed rather quickly. If you can talk about that.
Sure. I've had lots of patients ask me. I'm an outpatient provider, so I see lots of patients on a regular basis, and everybody has asked me, but it's so quick. Why is it so quick? And people have to understand there's very few, this has never happened in our history where all resources of all these major companies and technology companies and industry have come together to work on one thing. That's one of the reasons it's so quick. It's not that it's unsafe, but most times we never have this amount of resources all put into one single effort. So that's one of the main reasons why it was developed so quickly, was because nobody was focusing on anything else. All resources were solely in developing these vaccines. And fortunately, Moderna and Pfizer have come out with two rather effective, very effective from the preliminary data, vaccines at preventing coronavirus. So the preliminary data looks fantastic. That might change a little bit. We don't expect it to change a lot as we see more patients being vaccinated, but it's incredibly exciting. And we've now had an even better trial in the past couple weeks of millions of people being vaccinated across the United States and locally. So we can see what's happening with the reactions and safety and things like that too.
Very good. Now, once you get the vaccine, do you have to wait a certain time and get another shot, or how does it work?
Correct. Yeah. So depending on which vaccine you receive, so the Pfizer vaccine is a 3-week interval. The Moderna vaccine is a 4-week interval. So you do have to get that second booster shot, and that is what the United States and the CDC are recommending here.
What are the side effects of the vaccine?
Some of the other common, most times that's the most common thing we're seeing is just a mild sore arm. Some people, like my father who had the vaccine, didn't feel a thing. His arm was perfectly fine. The other, I think I'd say more on the serious side, but not very serious, would be kind of mild allergy symptoms. I've had a few people complain of some hives, some feeling of itching, and that goes away within 24 hours for the cases that I've seen. We have not seen, at least locally, any cases of severe allergic reactions like anaphylaxis, where you get tongue swelling, difficulty breathing. We have not seen that locally, although those have been reported.
When we get the vaccine, that does not mean that you should not be wearing a mask or social distancing.
Correct. Yeah, those things are incredibly important. And because one thing that we still haven't figured out yet, the studies we know that the studies prevent you from getting severely ill from the disease. We think it should prevent some of the transmission, but we don't know that for sure yet. The vaccine takes some weeks to work. It doesn't work within a couple of days, or sometimes the infection was already in your body when you got the vaccine. It's difficult. So we don't want people to let their guard down just because they got their first dose, or in fact their second dose.
Very good. Hopefully, like you said, there is light at the end of the tunnel. We'll be seeing a better spring and summer 2021. And I thank you for the helpful information here on SSPTV News.
Thank you. Thank you for having us.
Today's news feature is brought to you by Feisner's Ford in Freeland, who is celebrating 75 years in business. Give them a call at 570-636-3920, or you can log on to feisnersford.com.